Hello, I'm Dr. Sakarya. Today I'm going to talk about the reconstruction of a missing finger, toe-to-hand transplants. If there is a missing finger in the hand because of a trauma or sometimes congenital reasons, we have an option to reconstruct it by toe-to-hand transfer or transplant. So what we do actually is to take one of the toes, generally great or second toe, and to transplant it with its artery, vein, nerves, tendons, bone to the hand. Generally, the best candidate for this surgery is for those who has lost their thumb in the level of this area after an accident. In those cases, the recovery process is very smooth and the functional outcome is generally outstanding. But still, we can do this reconstruction for other fingers as well, for the second finger, third finger, or little finger. When there is more than one finger missing, then we can do two transplants. For example, one for the thumb and one for the second finger. Toe transfer is a standard approach for this kind of reconstruction because toes are our natural, actually, fingers with its own nerves, similar arteries, similar feelings, and with tendons for movement. Prosthetics are also common for fingers, however they don't have any sensation, they don't have any function. Although they are good for aesthetic purposes for some social events, they have basically no function. After these surgeries, our first aim is to gain some functionality, for example, pinching, grasping, sensation, and some good aesthetical appearance. These surgeries are very complex surgeries and needing a lot of microsurgery experience. The surgery generally lasts long, however the recovery is generally smooth, and physiotherapy plays a crucial role after these surgeries.
Taking a toe from the foot ruins walking.
No, it's false, because the area we take toes are a little bit beyond the functional joint in the foot. So we don't expect any functional loss in the foot unless we need a very long finger segment for the hands. And even in these cases, the only problem would be to running fast uphill. But other than that, for second toe transfers, for short segment of great toe transfers, we expect no functional loss in the foot.
This operation is only for cosmetic purposes.
No, this surgery is actually mainly for functional purposes. Aesthetic comes second for these type of surgeries. I'm a plastic reconstructive and aesthetic surgeon specialized in microsurgery, head and neck reconstruction, and peripheral nerve surgery. I was trained by Fu Wei, who is one of the pioneers in toe-to-hand transplants, and I have been doing microsurgery for more than 10 years. A missing finger can be devastating after a trauma. However, we have some options to reconstruct that. Please feel free to consult us. Thank you.